All right, welcome to the next installment of Live Well with UCI Health. I'm Ryan Mano from Coast 103.5, iHeart Radio. Thrilled to be joined today by Dr. Christopher Paiji, board-certified UCI Health gastroenterologist. You specialize in the treatments of various GI issues, pancreatic things of this nature. So we're going to talk about pancreatic cancer. It's obviously, I would venture to say, the most feared thing to hear, right? If you get that diagnosis, oh God, right? I mean, I know even just, Alex Trebek, Steve Jobs, right? They're two of the most well-known, celebrities that passed from it. Why is it so feared? And, I guess the flip side of that is what gives you hope with what you do?
Absolutely. That's a great question. So pancreatic cancer is one of the most challenging cancers that we face. And one reason is that typically we find it too late. Most patients who are given the news of pancreatic cancer are found to have it in advanced stages. And that limits treatment options and potentially lowers the chance for a cure.
Sure. Yeah.
And another reason that pancreatic cancer is feared is because the rates are increasing. It's predicted by 2030, pancreatic cancer will be the second leading cause of cancer-related deaths in the U.S.
Why is that? Why is it increasing?
Yes, I think there's a couple of reasons. It's probably due to a number of risk factors, I think, that are still being studied, but potentially it may be related to increased body weight.
Okay.
Also related to smoking and excessive alcohol use as well.
Yeah, interesting. This might be just a really silly question, and I clearly wasn't paying close enough attention in biology or health class. Where is the pancreas located?
Yes, so the pancreas is an organ that's deep in the abdomen. It actually sits behind the stomach.
Okay.
And due to its location, that makes it one of the more challenging cancers to diagnose.
Sure.
Because pancreatic tumors can grow very quickly, but also silently in this location without causing any major alarm symptoms at first.
Got it. And just going to get all my my silly questions out of the way. I mean, you're probably like, who is this guy? He doesn't know anything about pancreas. What does it do?
Yes, so the pancreas has very important functions. It produces enzymes that help us digest our foods.
Oh.
It also makes hormones that help regulate our blood sugar and our overall metabolism.
Is it one of those situations? Because I've learned a lot throughout the course of this series. Some of the things that we've discussed you don't know because the symptoms aren't there until it's stage 4 or advanced, right? Is that another one of these situations?
Yeah, that's what makes it difficult with pancreatic cancer. The symptoms may not be obvious in the beginning. Some symptoms to look out for include a loss of appetite, weight loss, lack of energy, discomfort in the upper portions of the belly and back, and jaundice, which is where the white portions of the eyes become yellow, the skin may turn yellow, and the urine becomes dark.
Yeah. Before we get back into the screenings and stuff, what drew you to this field, just personally for you?
While I was in medical school, I was fascinated by the digestive system and treating patients with digestive conditions, including pancreatic cancer. I worked with amazing professors who really inspired and guided me to work towards becoming a gastroenterologist. And while I was pursuing this interest in medical training, my own father was diagnosed with pancreatic cancer, and he passed away from it.
Oh, my goodness.
Through that experience, I gained an important perspective on what patients and their families go through with pancreatic cancer. And my goal is for every patient to help them achieve the best medical outcomes, but also genuinely empathize with the experiences that they and their families are going through.
Sure. When you have to, consult with patients that may be fighting this or dealing with this, do you share that with them? Like that this was your journey with your father?
Yes. Yeah. In certain circumstances where that would be appropriate, I think it does help them to show that I can understand the anxiety that they're going through.
Yes.
I can understand how important support is for a patient that goes beyond medical treatment, including social support, and all those things. So I do let patients know that I'm here for them.
Yeah. Because it is, like you said, it's it's deep in the abdomen. Did you say abdomen or the stomach?
Yes.
Okay, that's fine. How do we get it earlier? How do we see this earlier? What are some things that we can do to detect this before it gets to bad things?
That's a great question, Ryan. So right now, we do not have pancreatic cancer screening for the entire population.
Okay.
We have screening programs for those who are considered high risk for pancreatic cancer. And so I think it's important for everyone in the community to be aware of medical conditions that run in their family, including cancers. There are two reasons why someone may be eligible for pancreatic cancer screening.
Okay.
One reason is due to a strong family history, including multiple relatives and at least one immediate family member with pancreatic cancer. And the second reason is because they underwent genetic testing, which shows that they have a change in their genetics that predisposes them to pancreatic cancer.
And what types of changes are we talking about in that?
Yes. So, these are what we call changes or mutations in genes.
Oh.
These include genes that you may have heard of before, including BRCA.
Okay.
And
I've heard that.
You've had
Yeah.
that in addition to the gene for Lynch syndrome.
Okay.
We typically think of some of these genetic changes related to other cancers. Like for BRCA, we think of breast cancer and ovarian cancer. And Lynch syndrome, we think of colon cancer. But in fact, these genetic changes will also put them at increased risk for pancreatic cancer as well.
Interesting. In your position, doing what you do you wish that everyone had access to pancreatic screening?
Absolutely. I think that we are still working on that. And I do foresee a day in the future where that is more of an availability.
Sure.
I think that what we're working on is improved testing for screening. There are promising blood-based testing that are currently in the works, but are still in more of a investigative phase.
Yeah.
But my hope is that in the future we will have something that's more widely available.
Well, and I mean, I'm basing that off of what you said. If you said by the year 2030, it's going to be the second leading. I mean, if that's the trend, you would think that the medical community or however it works would say, wait a second, we have too many people. We're losing way too many people to this, right?
Absolutely. Yeah, absolutely. There's a big motivation in the community to continue performing research in this area so that we can detect pancreatic cancer earlier, which we know that this will be important in affecting overall outcomes with regards to treatment.
Yeah. You mentioned, the high risk factors in terms of, family history and change in genetics. What type of lifestyle things are, possibly contributing to this?
Absolutely. So there are modifiable factors that we can control to reduce our risk of cancer. This includes avoiding smoking and excessive alcohol use and maintaining a healthy weight. So these are things we consider important for maintaining our overall health. It's also good to note that taking control of these factors also lowers our risk for cancer.
Sure. Just in general, right? Yeah.
Absolutely.
Just be healthier, right?
Exactly.
as best you can. Yeah.
Yes.
So let's talk about, you have your specialist here at UCI Health. There's a whole team of you guys. What does care for a patient, from a teamwork perspective, once they're with you and once you guys have gotten this figured out with what they're dealing with, how does the care look from there?
Absolutely. So I feel very fortunate to be working at UCI, where I work with a team of specialists. And for every patient, the plan of treatment is discussed as a team that includes oncologists, surgeons, radiologists, gastroenterologists like myself, and other specialties. There are formal meetings that are occurring to discuss plan of care.
So you guys will sit down with each other first before going to, okay, got it.
So we have these regular tumor boards.
Yep.
And on top of that, Ryan, we're constantly communicating with regards to the care of our patients. We are always discussing what are the next steps to help provide the best care for our patients.
And let's talk about some of those next steps. Innovative treatments. I know you guys are constantly looking forward at, what's coming, what's next. I mean, what are some of those treatments that you're really behind right now?
Absolutely. So there is an increasing number of advances in treatment that gives us hope to improve care for
and that's
pancreatic
important.
cancer.
You hope, right? That's all you're looking for at that point, just some hope.
Absolutely.
Yeah.
One of the important advancements is the increasing role of robotic surgeries to remove pancreatic tumors. So our surgeons can use robots to help perform highly complex operations with smaller incisions, quicker recovery time, and potentially less pain than traditional surgeries. With regards to cancer treatment, there are an increasing number of treatments that are becoming available for pancreas cancer that may more effectively treat it and be better tolerated with less side effects. This includes treatments such as targeted therapies and immunotherapies, which help enhance the body's own immune response to target cancer cells and destroy it. And lastly, from a gastroenterology perspective, which is sort of my field of interest, there is a role for ablation or delivering treatment for pancreatic tumors. So I think there are a number of treatments that are developing that increase the optimism for treating this cancer.
How do people come find you? How do they get to you?
So I see patients for pancreatic cancer in a number of different ways. I think probably the most common way is a patient underwent a scan to investigate their symptoms, and they were found to have a tumor of their pancreas. So I perform a procedure called endoscopy, specifically endoscopic ultrasound, to get detailed images of the pancreas, identify the tumor, and take a sample of tissue, also known as a biopsy, to confirm the diagnosis and help them get to the right specialist to get treatment. There are other reasons why I might see patients, including overseeing the pancreatic cancer screening for patients who are high risk, monitoring precancerous growth of the pancreas. And lastly, patients with more advanced cancers with complications because of the tumor enlarging, they may develop blockages of their digestive tract. And I could perform procedures to place these flexible tubes called stents to help improve their symptoms and their overall quality of life.
It's incredible. You do these procedures.
Yes, and thankfully, again, with the advances in the techniques of what we're doing, we can do things that provide great help to our patients, can do it in minimally invasive manners, and help patients enjoy meaningful activities, like sitting down with a family member to enjoy a meal.
What are the benefits to coming to an academic health system like this great? I mean, all the people here are incredible. By the way, have you been to that new campus in Irvine, the new hospital?
Yes.
Holy moly. That place is unbelievable. Are you going to start working out of there?
I'll be working out of there as well.
Lucky. Gosh, I wanted to stay there for a weekend, you know? It's just like an Airbnb situation. What are the benefits, though, of coming to an academic health system like UCI Health?
Absolutely. So we have multiple renowned centers that include treatment providers that provide care for pancreatic cancer. One of them includes the Chow Digestive Health Institute, which is composed of surgeons and gastroenterologists who manage complex digestive conditions such as pancreatic cancer. We also have the Chow Family Comprehensive Cancer Center, which is one of the few nationally recognized centers for providing truly comprehensive care for cancer. So, with pancreatic cancer, we should think of it as it's important for every patient to have a team of providers who are dedicated to providing personalized and compassionate care. And thankfully, patients can receive all of that with leading experts all in one place at UC Irvine.
Given your family history, your risk factors, have you been screened?
I have been screened.
Good.
And genetic counselors help patients who are at higher risk get access to screening tests and also help them better understand their risk for pancreatic cancer and other cancers.
Was that nerve-wracking to you to get your screening to some degree?
Initially it was, but I came down and realized that it's just really important to have that knowledge.
Right.
And so I'm very grateful to have had that experience.
You can't be out here telling everyone else to do it and you're, I don't want to do it. You got to do it.
That's very true.
Dr. Paiji, let's talk about the screening process. What would you suggest is the right age for someone to start getting screened? And once they do, let's say I'm nervous, right? It's in my family history, what is the process like? If I'm going in for my screening today at 10 a.m., what is that? So that's a two-part question. Let's start with the age.
Absolutely. So the age really depends on a number of factors. That includes the earliest age at which a family member was diagnosed, the type of genetic change that the patients are found to have on genetic testing. Those are multiple factors because genetic changes that are associated with the highest risk of pancreatic cancer are advised to go undergo screening even earlier.
Okay.
Furthermore, patients who have family members with pancreatic cancer that were diagnosed really early are also eligible for cancer screening potentially up to 10 years before their family member was diagnosed.
Okay. So then walk us through what happens, right? Like if I have an appointment for a screening, what is the actual physical process of the screening?
Yes, exactly. So screening programs may differ from place to place.
Sure.
We use a combination of imaging to perform that. One modality is doing an MRI and alternating that with another procedure called an endoscopic ultrasound, which is a specialized procedure that I perform.
Got it.
This combines the technologies of endoscopy and ultrasound to allow us to create very detailed images of the digestive tract, including the pancreas. So typically we recommend undergoing a study once a year for pancreatic cancer. And typically for my patients, 1 year I may recommend doing the endoscopic ultrasound. And then the following year, I may recommend getting an MRI.
So you mentioned the age portion, right? So the age at which it was detected in someone else might be the right age for you. Does this typically affect, people higher in age? And then what's the youngest that you've ever seen this present itself?
So pancreatic cancer that occurs in patients without a known genetic change or a family history, most of these new cases will come at an older age.
Okay.
But pancreatic cancer that may be related to a genetic condition may present earlier.
Like how early?
Well, it really depends on the type of genetic condition.
Okay. I love that was, your passion. I mean, obviously the situation with your dad is horrible, but I love that you followed your passion and you're able to keep it alive and really to some degree keep, doing that for him, right? It's neat that you get to help others that are maybe in that situation that you were in. So
absolutely. Yeah. Just that personal experience continues to drive my passion, to try to spread awareness and, help every patient make sure they get connected with the right resources so that they feel supported.
Yeah. What would be your final takeaway, to somebody that, maybe is high risk or, watching this that doesn't know much about it? What's your message to somebody about what you do?
So I want everyone to recognize pancreatic cancer as being a serious condition. Yeah. One that is a leading cause of cancer-related deaths. But we do have hope for improved care with significant advances in treatment, especially in recent years. I think it's important for every patient to be closely aware of their symptoms, of the risk factors, and their own family history. Yeah. So that if they get pancreatic cancer, we detect it early, and we are able to obtain the best medical outcomes for them. Yeah. Good stuff, Doctor. Thank you so much. Very, very insightful. I appreciate you. Thanks so much for having me, Ryan. Thank you. Live well with UCI Health.